Great. We'll now move on to the lightning round. This year's inaugural lightning round will highlight the innovations and ideas of early-stage companies in a fast-paced format. Each speaker will have 4 minutes to answer the question, how does your company change healthcare? Unfortunately, we do not have question and answers for this particular session. If you want to contact any of the speakers, I'd encourage you to find them at lunch, or we also have note cards at the registration counter, which you could fill out, and we'd make sure that your message gets through to the speaker. The session will be moderated by Professor Nitin Joglekar, who's the Associate Professor and Dean's Research Fellow here at the Questrom School of Business. Professor Joglekar is an expert in design thinking, startup operations, and tech management. Without further delay, Professor Joglekar. Thank you.
Good afternoon, everybody. Our first speaker today is Elliot Swart. Elliot is the CTO of 3Derm, and he's been an innovator since his college days at Yale. When he formed a team to innovate and work on a 3D skin imager, and now he's responsible for the next generation of 3D imaging technologies. Welcome, Elliot.
In the US, there are 30,000 patients for every one dermatologist. The average wait time for an appointment is 38 days, but melanoma can metastasize in less than a month. Hi, I'm Elliot Swart, Chief Technology Officer at 3Derm Systems, and we're building a triage solution to ensure that the patients who need to be seen get seen quickly. So what happens now is you're worried about something on your skin, so you go see your primary care physician. Now, they probably won't know whether it's cancerous or not, so they'll refer you on to a dermatologist just to be sure. But this is where we hit the wait times that I talked about, because unfortunately, the primary care physician can't determine the urgency of any given referral. So the dermatologist has to give them all equal delays. There is, however, a better way. Our solution starts by putting imaging carts in the primary care centers. These carts include multiple dermatological imagers, including our proprietary stereoscopic 3D camera. Yet we designed our software to be easy enough for even occasional use by a nurse. So now when you see something on your skin, you go to primary care, and you can be imaged as easily as having your blood pressure measured. But our system ensures that the images are all clinically useful, and then sends them up through the cloud to our dermatologists, who diagnose them on high-resolution, color-calibrated workstations. And this is where they can determine if someone needs to be seen right away, eventually, or really not at all. They can also prescribe relatively simple treatments such as cortisone. Now, if a patient does need an appointment, they get automatically entered into our scheduling system, which matches them with an in-network physician, as well as arranges an appointment for them later, depending on their urgency of the visit. So there are a couple of iPhone systems that claim to do this. However, ours is substantially more reliable and proven. Our software is built and is highly tested, built to FDA design control specifications. We have run 3 clinical validation studies on our system, including one that actually showed how dangerous it is to use an iPhone for skin cancer detection and triage. So this is all great, but how do we get paid? So, as many of you may know, telemedicine reimbursement is a bit of a Wild West. But luckily, we have an opportunity in the form of accountable care organizations. Now, accountable care organizations, or ACOs, are fee-for-value systems that are incented to both reduce the cost of care, but also increase the quality of said care. And we can help them do this by reducing the number of unnecessary patient visits, by catching cancer in its early, more inexpensively treatable phases, by increasing their quality score so they can actually get more money from their insurance companies, and finally, by keeping more patients in network to prevent them from paying the extortionate out-of-network fees. 4 years into this mission, and we're well underway. We raised a funding round last year, and in addition have raised more than $1.5 million in non-dilutive funding. We're rolling out to our first customer this year, with 3 more rollouts planned for next year. So right now, what we're doing is hiring talented developers to help further improve the 3-derm system, as well as a program manager to help interface with customers and ensure a successful rollout. So if any of you know brilliant, enthusiastic people, please encourage them to apply at 3derm.com/careers. Together, we can lower healthcare spending, reduce wait times, and save lives. Thank you very much.
Thank you, Elliot. Our next speaker is Rich Bavasso. Rich is a serial entrepreneur. He has done a number of startups involving healthcare and digital effectiveness. In 2007, he was identified as one of the top 100 most influential people in pharma, and he currently serves as the Chief Commercial Officer for a company that he's just rebranded. By the way, I love the name of your company. It's Insightfil. So with that, welcome, Rich.
Thank you. First of all, for you students in the audience, 4 minutes is a lifetime for a startup to make a presentation. Usually it's 30 seconds or less, and you're actually in an elevator. Bring up the whole slide if you don't mind. The societal costs of medication non-adherence or adverse drug reactions is absolutely staggering. In the course of a year in the United States, 700,000 hospital readmissions, 1 death every 19 minutes, $2,000 added per person in doctor visits, all in all about $290 billion impact on the healthcare system on an annual basis. This is people not taking their drugs when they're supposed to, taking the wrong drugs at the wrong time, or taking multiple drugs, over-the-counter nutraceutical and prescription drugs, inappropriately. It's a serious problem. There are many offerings in the marketplace to help resolve this. Some of them clinician endorsed. Your family member has maybe a day minder where they put the pills in one at a time for each Monday, Tuesday, Wednesday. And there are other alert mechanisms and apps that are trying to address this platform. We've been awarded a $2 million NIH grant to create a comprehensive system and hit all endpoints of the medication adherence problem. And looking at my slide here, the system starts connected to the EMR at the clinic. So the physician's instructions, not only the e-prescription, but the actual instructions that we all forget as soon as we hit the parking lot when we leave the doctor's office, are reproduced and sent to our proprietary robot in the Insightfil pharmacy. This pharmacy is located in Texas and services 50 states. In real time, when that message hits from the clinician, this package is produced and printed right off the robot. All the physician's instructions, the pills are dispensed, pick and place in each of the blister, the appropriate information is placed on the blister, and there's technology that links to the app that lets people know when they should take the pill, did they forget to take the pill, and if you didn't, we'll call your mother, or we'll call the doctor. And it's directly linked back to the clinician. So there's a full loop system managing all aspects of this care. You can see we've got robotics, software, packaging, and apps, all designed to address it. And the exciting thing is, because we're a data company, and hence our new name, Insightfil, the pill filling part is obvious. But the insight is the data we're trying to generate to predictive modeling, if you will, to help clinicians decide how is this patient at risk from a medication adherence perspective. Today, this month, Hartford Healthcare System in Hartford, Connecticut, is doing a clinical trial with our platform, 400 oncology patients in an integrated medical center. Integrated Medical Center dispenses pharmaceuticals and nutraceuticals to the patient. So we'll hopefully by February, we'll have the baseline data to begin to make recommendations on how to fine-tune our system and how to help clinicians do a better job of medication adherence. My ask today, by the way, for you students, you always have to ask the people you're presenting to for something in return. My ask today is not money, because we're very well funded, but we need patients, we need clinics, and we need more data to validate the system we're trying to build. Thank you.
Our next speaker is James Fox from OpDesign. He's the co-founder and chief executive officer of this company, and he's done an amazing amount of work in a number of places, including Africa and Latin America. Welcome, James Fox.
Thank you. Thank you. Can you hear me okay? Great, great. Thank you for having me. It's an honor to be here. Last week, I was in a rural health clinic in Nicaragua, and it was hot and humid, crowded, maybe 100 people there. I was with a medical NGO, and they were screening people for anemia, and it's a blood test. So the kids that were there were crying and screaming. They were poked, not having a good day. And it's a challenge because they only run this once a year. So everybody that has anemia only gets monitored every year, and treatment only comes once a year. And at this time, last week, the crops had come in early in this area, so we were only able to reach about 20% of the people in this community, 20% of the kids. And by the way, at the end of the day, we ran out of some of the consumables that were involved with doing the blood test, so we had to stop. My name's James Fox. I'm CEO at Ops Design. We are focused on medical devices for global application. So we're thinking about technology. Oh, thank you. We're thinking about technology for areas like Nicaragua and also thinking about applications here in the US. We're currently working on anemia diagnostics. You may not know, but anemia is a massive problem. 2 billion people, 1/4 of the world's population, are anemic. And it's most serious for kids under 5 and for pregnant women. It's largely driven by malnutrition. Basically, a lack of iron in the diet causes the body to be starved of oxygen. For kids, it means impaired physical and mental development. Those kids that aren't being diagnosed suffer lifelong consequences. And it's sad in a way because anemia in serious cases kills about 1 million people every year. Treatment is widely available. Iron supplementation is ubiquitous, but diagnostics are really tough. Currently, blood testing is used around the world, and it is slow and expensive and risky. In places that are dirty or unclean, there's an infection risk. It involves consumables, so healthcare providers stock out. They can't continue the testing. And it's hard to reach everybody. Ultimately, many, many people just are never diagnosed and ultimately are never treated. At Ops Design, we have a better solution. This is Insight. Insight is a non-invasive anemia diagnostic device. It's designed to replace blood testing. And because it's non-invasive, we can reduce the cost to healthcare providers by 98%. We can deliver results to patients in 60 seconds, and we get rid of needles and consumables to make it a lot easier. And because we're thinking about developing countries, we're designing for portability, for durability, for ease of use for healthcare providers that may have an elementary level education. And it works based on optical technology, very similar to a pulse oximeter. So very, very simple. Last week, we were there because we were running a full pilot of our device. So we're comparing against this blood testing system. Really challenging. Ops Design has partners in Latin America, Africa, and Asia, and we are on track for first product sales in August next year. So we're moving really quickly. This is short, so if you want to learn more, hop on opsdesign.org. It's obzdesign.org. Or find me afterwards. I'm happy to chat. But addressing this question of how are we changing healthcare, for us, we are redirecting the technological resources that we have towards healthcare providers that really need it. And we're doing it in a way to deliver solutions so that patients like this one can go on to live full lives that they deserve. Thank you. Thanks very much.
Our next speaker is Likovich. He's the CEO of GoodLux Technology. They're a producer of SunSprite, the wearable sun and light tracker. His background includes a PhD from Harvard, where he wrote a dissertation on novel methods of light emission and collections in semiconductors. Welcome.
Thank you. I have a good college friend who suffered terribly from depression. She went to see a doctor, and that actually made things worse. The doctor didn't spend much time with her, just sort of blindly prescribed her an antidepressant medication, told her to go home and start taking it. In just 6 weeks, she gained 20 pounds, and she was so sedated that she can't remember trips that she took with us or time that she spent with her family. My guess is that many of you out there have a similar story about depression with a friend or a loved one. Our company is GoodLux Technology, and we're a collection of Harvard Medical School doctors and data scientists who know that we can do better for the 31 million Americans suffering from depression and the 65 million Americans who have trouble going to sleep each night and waking up each morning. It turns out that something as simple as getting the right amount of bright light at the right time of day can be effective at treating both depression and insomnia. The way that it works is that light enters your eyes, hits your retina, and travels directly to the hypothalamus via electrical impulses. This tells your body when it's morning and when it's night. It sets your circadian rhythm, and your body's hormonal cycles operate off this. Bright light has been clinically proven to be as effective as Prozac, but work 4 times faster and have no side effects. It works equally well for sleep disorders. And we actually have Olympic athletes using our product right now because having an optimized circadian rhythm has been shown to improve athletic performance by 10%. So we took our expertise and we created this device. It's called SunSprite. It's a wearable device that tracks the amount of bright light exposure that you get. It tells you how much you've gotten, how much more you need, and it connects with your mobile phone so that you can tailor your light profile to your exact sleep and wake cycle. It'll tell you when your optimal time to be getting bright light is. And we're most excited that we're changing lives with this technology. We just finished up a series of validation pilots, which we ran with 7 clinics and 31 patients who were suffering from depression, most of which were already on antidepressant drugs. After just 2 weeks with SunSprite and getting bright light, 88% of them improved. And all 10 of the participating clinicians recommend SunSprite as effective depression therapy. So I'd invite all of you, if you want to learn more about bright light therapy and SunSprite, to check us out at sunsprite.com and come learn more about light and join us on our journey. Thank you.
Thank you. So for the next round, we have 2 speakers, right? Yep. We have Alex MacFayden. He is actually alum, and welcome back.
Yep.
To Boston School of Business. Yep. And since completion of his MBA, he's joined meQuilibrium. I'll talk about them in a minute. And he's joined by his colleague, Janet Yeung. She's on the sales side of the house, and she's been working on streamlining the process, the sales process for meQuilibrium. So with that, I invite you to speak.
Great. Thank you very much. Good afternoon, everyone. Jan and I are here to talk about meQuilibrium, a series-funded tech startup in which we both work. And we are here to talk about what meQuilibrium really does is it's a way of building resiliency in the workforce. And one of the first questions that we're asked is, what does it mean to be resilient? And I think sometimes the best example, or the best description, is a good example. So I'm going to read a quick story about one of the most resilient people to have ever lived, and that is Abraham Lincoln. So Abraham Lincoln came from very humble means in the Midwest. He had to start work at the age of 9 after his mother passed away to help support his family. And here's the story between now and then and just how resilient he was in the face of adversity. So in 1832, he decides to run for local office. He loses. In 1834, he runs for local office. He's elected. In the next 4 years, he runs for the House speakership twice and loses both times. In 1843, he runs for Congress. He loses so badly, he's not even on the ballot. In 1846, he runs for Congress again. He's elected, only to be kicked out 2 years later when he runs for re-election in 1848. In 1854, he runs for the House Senate. He loses. He runs for the vice presidential nomination in 1856. He loses. He runs for the Senate again in 1858. He loses again. And then in 1860, he's elected president. So this is a really good example of resiliency in a nutshell, which is how do you respond? How well do you respond to adversity when you're faced with it? And now to talk about how meQuilibrium can help bolster that in the workplace, I'm going to leave it to Janet.
Thanks, Alex. Okay, so meQuilibrium offers a resilience training platform. And as Alex just defined for us, resilience is really your ability to bounce back from setbacks. So our company's been around for 5 years. We just raised $9 million in Series B funding back in April. And our clinically validated product is really the brainchild of our 3 co-founders. So first we have our CEO, Jan Bruce. She is an expert in consumer wellness, and she actually ended up selling her first company to Martha Stewart. The second co-founder is Dr. Adam Perlman. He's our chief medical officer, and he's a very well-regarded doctor of integrative medicine at Duke University. And then finally, we have Dr. Andrew Chate, who has a PhD in psychology and is a fellow at the Brookings Institution. He's now our chief science officer, and he's really the one responsible for a lot of the science behind the product. So much of this is based on cognitive behavioral therapy, or CBT. Some of you may have heard of it. The principle there really is that thoughts drive your behavior. So in order to make a change in your behavior, you have to reframe your thinking. So how do we do this with meQuilibrium? Well, it starts with a 10-minute assessment. It asks you a couple questions about your emotional well-being. And then from there, it generates a profile for you. And that's made up of what we call our MEQ score. It's a resilience score over 4 different dimensions. So mind, body, surroundings, and connection. And then it also tells you what your stress personality type is. So we had 5 different personality types. And one example is a caregiver. That's someone who puts everyone else before themselves and kind of takes on everyone else's problems as their own. So that obviously contributes to their stress. So after finding out your stress personality type, you learn what kinds of factors such as body image, weight control, pain management, sleep, connection to work, really act as buffers to your stress, or which kinds bring you down or drag you down. We call them drags. And so this is going to be really different for everybody. It's personalized, and our program comes up with a customized roadmap of skills and activities for you to do at your own pace digitally. It's all online, and we also have a mobile app for both iPhone and Android. So these modules, these skill modules are really made up of videos and interactive exercises that you go through, and it really helps you think about how you respond to stressful situations and how you might be able to do that more effectively.
We've had incredible success selling to Fortune 50 companies where we've reduced overall healthcare costs. We've increased how present employees are at work and how focused they are, how engaged they are at work. And in the end, we've made more happy, more resilient employees. Thank you very much. Stay resilient.
Last but not the least, our next speaker would be Tom Torre. Tom has a broad expertise in the area of healthcare as well as financial services. He was a senior VP at FIS Global, and he was also co-founder at Elliot Technologies, and he's going to tell us about his new company, CoPatient.
Thank you. Thank you. I'm honored to be here today, but I'm also a little bit intimidated. I think I'm the only person up here who doesn't have a PhD after their name. So I'm here today to speak about something a little bit different than what we've been talking about so far. I'm going to talk a little bit about the changes in the way that consumers pay for healthcare. The last 12 years of my career has been really focused on helping to make change in the way that consumers pay for healthcare and the way that money moves through the healthcare system today. I'd like to draw your attention to the top left of the screen. There's a shift, really a movement going on to change the way that healthcare is bought and paid for. This shift is sometimes referred to as consumerism or healthcare consumerism. And the idea behind healthcare consumerism is to shift more responsibility to consumers. That shift is a shift in choice, a shift in decision making, but most importantly, a shift in financial responsibility. The theory goes like this. If consumers have more responsibility for financial obligation, they will make smarter, more cost-effective decisions. And as healthcare consumerism has taken hold and employers are moving to high-deductible health plans, offering health savings accounts or HSAs, and changing to defined contribution solutions versus defined benefit, the amount of money that we as consumers pay out of our pocket for healthcare continues to go up. And the numbers are huge. If you draw your attention to the top right of this chart, the out-of-pocket expense that consumers paid in 2015 will probably cross $400 billion. And that number is going to continue going up, and in the next 5 years, it is likely to cross $500 billion. Now, you've probably heard a lot of talk about efforts by Obamacare and other things to bend the cost curve and to change the trajectory of the nearly $3 trillion a year that are spent in the U.S. on healthcare. And even if those efforts are successful, which we could debate that and spend a lot of time talking about that, if they're successful, it doesn't matter for consumers. The portion of healthcare that we as consumers pay for will continue to go up, and there's no end in sight. On all the different things that are being talked about today and all the different efforts going on in the industry are great, but it is for sure that consumers' expenses for healthcare will continue to go up. And the implications are significant. If you look at the bottom left of my page, you can see that today, doctors, providers only collect about 20% of what's owed to them by consumers. My background's in financial services and credit and consumer credit, And if consumer credit had that same kind of collection rate, there would be no consumer credit. So healthcare is really unusual in this way that providers only collect a certain portion, a small portion of what's owed to them. I still can't to this day believe that that number is true. And the interesting thing is, the greater the consumer expense, the less likely they are to pay. If you have a $100 bill, you're more likely to pay that than if you have a $1,000 healthcare bill. And it's important to understand, excuse me, it's important to understand that consumers don't pay their bills sometimes, not because they don't have the ability to, it's sometimes because they choose not to. They choose not to because we as consumers have an uneasiness with high dollar healthcare amounts because we've been trained through the years that we make a copay or a co-insurance payment. And the second is large medical bills are frequently very complicated, and it takes a supercomputer or a magic decoder ring to figure out just exactly what you're being charged for or what you owe. So these changes in the healthcare landscape have driven the need for new ways for consumers to make payment. And that's what CoPatient is all about. We are committed to the principle, and we're founded on the principle that paying for healthcare should be easy. We define paying for healthcare as understanding what you owe, being able to make payment, having options available for you, and being educated on what's owed. And so at CoPatient, what we do is we provide a technology-enabled solution that allows consumers to understand their healthcare bills, enables us to work with them to negotiate fair, reasonable, and accurate bills with their providers, and gives them a solution to make sure that their healthcare that they're paying for is appropriate. Over time, our solution will expand to include financing options and easy payment options, and we are very committed at CoPatient to make the friction go away between providers and consumers. So if you only get one thing out of my conversation today, the one point that I ask you to take away from our discussion is what we're focused on at CoPatient is bringing technology to bear that simplifies the way that consumers and providers interact with the financial aspect of healthcare. Thank you very much.